You eat a normal lunch, not a binge, not junk. Then your body pulls the rug out. Eyes heavy, brain fog, patience gone. You start bargaining with caffeine like it is life support. That is not laziness. That is biology sending signals. A hidden blood sugar swing can do it. Inflammation can crank up the volume. The meal is not fine just because it looks balanced. Sometimes that slump is a normal dip. Moving to slide 2. A little sleepiness after a big heavy meal can be normal, especially if it was large, high-fat, or you ate fast. The red flag is when it hits hard after a pretty small meal, or it crashes you within about an hour. Another flag is when you feel like you cannot function without coffee to get back to baseline. Watch your mood too. If fatigue comes with irritability, sadness, or anxiety, that is often your brain reacting to falling glucose and stress hormones trying to rescue it. Here's a simple self-check for the next 3 lunches. Rate energy and mood at 0, 30, 60, and 120 minutes. If the low point is sharp and early, and you rebound only after sugar or caffeine, you are probably dealing with a fast spike and a fast drop, not just afternoon. Moving to slide 3. The fast spike trap usually starts with refined or low-fiber carbs that digest quickly. Think white bread, crackers, sugary yogurt, juice, rice bowls with little protein, or a healthy snack that is basically starch. Glucose rises fast in your blood. Your pancreas answers with insulin to move that glucose into muscle and fat cells. Sometimes the insulin response overshoots, especially if you are already insulin resistant, stressed, sleep deprived, or you ate the carbs on an empty stomach. When insulin is high and glucose drops quickly, your brain feels it first because it relies heavily on glucose and it is picky about sudden changes. That is when tired is really your nervous system hitting the brakes. You can feel foggy, shaky, hungry, or weirdly wired and exhausted at the same time. What to do at lunch is simple and specific. Slow the entry of glucose. Keep the carbs, but anchor them. Start with a fibrous vegetable or beans. Add 25 to 40 grams of protein. Include some healthy fat if the meal is very lean. Choose higher fiber carbs like whole fruit, oats, lentils, or cooled potatoes over refined grains. And if you know you are prone to crashes, take a 10-minute walk after eating. It pulls glucose into muscle with less insulin. Moving to slide 4. Inflammation makes this worse because inflamed cells respond poorly to insulin. Your body has to release more insulin to do the same job, which raises the odds of an overshoot and a bigger drop. That also means more fatigue signals and more cravings as your brain tries to protect itself. If your crashes are intense and frequent, it is often not just the food, it is the terrain you are eating on. Moving to slide 5. Your first meal of the day quietly sets your entire glucose response later. This is the second meal effect. If breakfast is mostly refined carbs, or you skip it and then slam carbs at lunch, your body tends to produce a bigger glucose spike and a bigger insulin response at lunch. That makes the afternoon crash more likely. If you want steadier energy without tracking anything, build breakfast to prime you. Aim for protein plus fiber first. Examples: eggs with vegetables and a piece of fruit, Greek yogurt with chia, berries, and nuts, a tofu scramble with beans. Oatmeal is fine if you make it high protein and add berries and seeds, not just honey and granola. Then keep lunch consistent. Protein and fiber again, and save the fastest carbs for after you have the anchors in place. If you already started the day poorly, you can still blunt the crash by making lunch slower, not smaller, and taking that short post-meal walk. Do that for 3 days, and you will feel what stable blood sugar actually feels like, before the sneaky stuff in drinks even enters the picture. Moving to slide 6. Liquid calories are the stealth crash starters because they hit fast and they do not make you feel as full. Juice is the obvious one. Even natural juice is basically a sugar drink without the fiber that slows absorption. If you drink it alone, your blood sugar can rise quickly, insulin follows, and then you feel that dip as hunger, irritability, or sleepiness. Sweet coffee counts too. A flavored latte, a syrupy iced coffee, even a healthy coffee drink with honey or a big splash of sweetened creamer can be a dessert you sip before you have eaten real food. Smoothies are tricky. If it's mostly fruit plus juice, it behaves like juice. If you add nut butter, it can still be very calorie-dense and the sweetness can keep you wanting more. Alcohol makes control worse by lowering food restraint and disrupting sleep, which can raise cravings the next day. If you feel an energy drop after liquid calories, that's a clue worth respecting, especially when the problem is not glucose at all. Moving to slide 7. Sometimes the crash feeling is not blood sugar. A big fatty meal can slow stomach emptying, so instead of a sharp spike and drop, you get a heavy, delayed slump. Blood flow shifts toward digestion, and that can feel like your brain is running on low power. Stomach distension is another signal. A large volume meal, even if it is not sugary, stretches the stomach and can trigger relaxation and sleepiness. Pay attention to timing. If you feel fine for an hour, then get sleepy and foggy later, that pattern often fits slow digestion more than a rapid glucose swing. Your move is simple. Reduce portion size at that meal, keep fat reasonable, and take a short walk after eating. If that fixes the heaviness, you just found your lever, and it leaves room for other triggers like histamine reactions. Moving to slide 8. Histamine can cause a very specific kind of post-meal fatigue. Aged and fermented foods are common triggers, like cured meats, aged cheeses, wine, vinegar-heavy foods, soy sauce, and some pickled items. Leftovers can be worse because histamine can rise as food sits, even in the fridge. Look for symptom clues that tag along with fatigue. Flushing, a warm face, itching, congestion, sneezing, a fast heartbeat, or a headache can all point in this direction. The tiredness often feels wired and drained at the same time. What to do? Run a short, clean test. Pick one suspect food, remove it for a few days, then reintroduce it in a normal portion and watch the same set of symptoms. If the pattern is consistent, you are not guessing anymore, and that can connect to a bigger gut barrier story. Moving to slide 9. If you bloat after lots of different foods, not just one, your gut barrier and microbiome balance might be part of the fatigue puzzle. Notice what happens within a few hours after eating. Gas plus brain fog is a common pairing. Stool changes after meals like urgency, loose stools, or constipation swings matter too.
Ultra-processed foods tend to make this worse because they are easy to overeat, low in supportive fiber, and often packed with emulsifiers, added sugars, and fats that some people do not tolerate well. Your move here is not perfection. It is information. Build a short list of meals that reliably feel calm, then compare what is different when symptoms flare. If your best meals are simple, minimally processed, and fiber-forward, that is a strong clue you can use. Now you can pressure test the pattern instead of chasing random fixes. Moving to slide 10. Use a 3-pattern test to figure out what kind of crash you are having. Pattern 1 is speed. If you feel bad within 30 to 60 minutes, suspect liquid sugar, a very refined carb load, or a sweet coffee on an empty stomach. If it is 2 to 4 hours later and feels heavy, suspect a large or high-fat meal slowing digestion. Pattern 2 is the type of fatigue. A sudden shaky hunger, irritability, and cravings fits a glucose dip. A heavy eyelid, couch-lock feeling fits digestion load. A wired, flushed, congested, or headache fatigue fits histamine. Pattern 3 is symptom tags. Write down 1 or 2 extra signs each time, like bloating, runny nose, flushing, heartburn, or stool changes. Repeatability matters. If you cannot reproduce it, you cannot fix it. Change one variable at a time, like removing the sweetener, shrinking the portion, or swapping leftovers for freshly cooked food. Once your pattern is clear, building a non-crash plate becomes almost automatic. Moving to slide 11. Build a non-crash plate by setting the anchor first. Start with a solid protein portion, then add plants for fiber at every meal. Match carbs to what you are actually doing. More on active days, less when you are sitting. Add healthy fats, but keep them modest so the meal stays balanced. And treat dessert as a choice, not the default. When your plate is built this way, your energy stops feeling like a gamble. Moving to slide 12. If your energy keeps crashing, check for low-grade inflammation signals your body is already giving you. First, a waistline that is slowly creeping up, even when your calories feel about the same. That often tracks with worsening insulin sensitivity and higher baseline stress hormones.
Second, sleep that looks long enough on paper but feels unrefreshing. Inflammation can fragment deep sleep, and you wake up wired, hungry, and foggy. Third, joint aches and morning stiffness that make you feel older than you are. That can show up when ultra-processed foods and alcohol crowd out omega-3s, protein, and micronutrients. Fourth, skin that flares after meals, like acne, redness, hives, or eczema. That can happen with repeated glucose spikes, high histamine foods, or specific intolerances. Fifth, frequent sugar cravings, especially late afternoon or after dinner. That is often your brain trying to correct unstable blood sugar and poor sleep. One sign alone is not a diagnosis. A cluster is a reason to take your patterns seriously and decide whether you can self-correct or need a professional set of eyes. Moving to slide 13. Some symptoms are not a try harder situation. If you ever have fainting, chest pain, or pressure, treat that as urgent. If you get episodes of rapid heartbeat, especially with dizziness, shortness of breath, or a sense of impending doom, you need evaluation for rhythm issues, anemia, thyroid problems, medication effects, or dehydration. Unexplained weight loss, meaning the scale drops without you intending to diet, deserves prompt medical workup. Bloody stools, black tarry stools, persistent diarrhea, or fever can point to infection, inflammatory bowel disease, ulcers, or other GI bleeding sources. Do not wait those out. Also watch for diabetes risk symptoms: excessive thirst, frequent urination, blurry vision, recurring infections, slow wound healing, or tingling in feet and hands. If your crashes come with shakiness, sweating, confusion, or you feel unsafe driving, that matters. A clinician can check glucose markers, iron, B12, thyroid, sleep disorders, and medications, and help you build a plan that fits your life. Getting help early is not dramatic. It is smart, and it is efficient. Moving to slide 14. For the next 7 days, keep it simple. Log what you eat and when you eat it, plus when the crash hits. Pick one meal to fix, usually breakfast or lunch, and build it with the non-crash plate. Cut liquid sugar first, including soda, sweet coffee, juice, and energy drinks. Walk 10 minutes after your biggest carb meal to blunt the spike and improve glucose handling. Subscribe for practical, evidence-based fixes you can use right away. Comment your crash pattern, the time it hits, what you ate before it, and how it feels. This content is educational and not medical advice. If you have concerning symptoms, seek care from a qualified clinician. Stable blood sugar changes everything.